Hi, my name is Shelley Lopez Gray, and I'm a registered nurse and an international board certified lactation consultant. I created this specifically for parents who want more information about breastfeeding. So, what do you already know? If you were in front of me and this was not your first baby, I would ask if you've ever breastfed before. If you haven't, what made you choose formula? Anytime I ever ask anyone this, they'll tell me that they didn't make enough milk, or their baby wouldn't latch. Some people will say that they tried to breastfeed but they thought it was too painful, and some people will tell me that they thought that giving formula would be more convenient. Let me just tell you real quick that my first daughter I breastfed for a really long time, and my second child, he just stopped at 8 months, and I was like, well, what the heck? Or I don't understand. What am I supposed to do? And I gave him express breast milk. I pumped and gave it to him, but I can tell you that giving formula was not convenient. When I was breastfeeding, I'd kind of wake up and slap him on the boob, and and then go back to bed. But whenever he stopped and I started having to give him formula, I'd have to wake up and I'd have to go downstairs and sterilize a bottle, and then I was expected to warm it up. And by the time I fed him and I put him back to bed, it was like he was waking back up again. It was really just like a nightmare. It was just so much easier for me to breastfeed. If you needed help or had questions after you deliver or after you go home, who would you ask for help? I always like patients to think about this while they're pregnant, because I think a lot of times we just think in our heads, okay, I'm going to breastfeed. That's the decision I've made, and you don't really think about, well, what am I going to do if I have trouble? When I go home and there's not a nurse around and there's not a lactation consultant, coming to my room, who am I going to call for help? And so I want you to think about that now before you have your baby. When you're thinking about that, think about anyone in your life that you've known who has breastfed. And, these people may be a surprising support for you. I always tell people it's about their mentality. Maybe you're a first time mom, maybe you're not. Maybe you are a first time breastfeeding mom, but you have to be determined and tell your family right now how important this is for you and for your baby, because you're going to need their support, and ask for help if you need it. I always tell all of my patients it's all about patience, practice, and perseverance. I kind of think about breastfeeding like climbing a mountain. After delivery, it may be easy, and you may think, oh my gosh, this isn't as hard as everyone told me it was going to be. Just know that it will probably get harder. If you stick with it, it will end up being the easiest thing you've ever done for you and your baby. And I tell every patient that breastfeeding is usually difficult at first. I don't tell anyone that to discourage them from breastfeeding. Obviously, I am like, totally pro breast, to pro boob, pro breast milk, but I don't want you to have trouble and then think, oh, there's something wrong with me or my baby. One of my bosses, they're constantly telling me, oh, I didn't have trouble breastfeeding any of my babies. And I always tell her, well, good for you. That's unusual. I help people breastfeed every day. And every day people, initially are like, I don't know if I'm doing it right. I don't know if, they're getting enough. I don't know, people are just so, they are so insecure. They're so not confident about breastfeeding that they second guess everything. And so just know that that's very normal, and if you just stick with it, it really will get easier. One of the most important things that you can do for yourself and for your baby is to place the baby skin to skin after delivery. Skin to skin contact means that you place the baby directly against your bare chest after you deliver. It should be immediate and uninterrupted. So, if there's nothing wrong with your baby, if your baby isn't sick, if they're not having trouble breathing, if your baby comes out pink and crying just like we want them to do, then your baby should be placed immediately on your chest. It shouldn't be, oh, I'm going to take the baby to the warmer and then assess the baby and then put the baby on you. It should be immediately on your chest. After you deliver, the nurse in most hospitals will give your baby erythromycin, which is an antibiotic that goes in the eye, and they will also give a vitamin K shot in the baby's thigh to help your baby's blood clot. And all of these things are things that can be done later, or they can be done while your baby is skin to skin. And that you can, a lot of times people go into the hospital and they think that they have no control over anything. But whenever you go, you can say that. You can tell your nurse, I really want my baby skin to skin after delivery. If my baby is fine, if my baby looks good, I really want my baby skin to skin after delivery. You don't have to take a baby to the warmer to know if a baby looks good. Okay, if the baby is crying in pink, then that they can slap the baby on your chest. And just let them know in advance that that this is your goal. Skin to skin contact is good for your baby because for a baby, one of the most important things is a baby's temperature control. We don't want your baby to get cold, and skin to skin contact is just as good as that warmer that they put the babies in. Okay, it is just as good as that radiant warmer, if not better. It's just like whenever you're in bed with someone and you're like, oh my God, get off of me, you're so hot. It's the same thing. It's like you're too close, and all of a sudden it's nice and warm. Okay, so that's just part of the magic of skin to skin. Babies who are placed skin to skin after birth cry less often and they're more soothed. I love that. I love that, that babies cry less often, when they're put skin to skin. Skin to skin contact also helps to stabilize all of an infant's vital signs. Everything from the baby's temperature to the baby's blood sugar to the respirations, and like I just said, even how they respond to pain. So, I mean, skin to skin contact really is like magic pixie dust. If you ever have trouble with anything, put the baby skin to skin. Moms who utilize skin to skin make more breast milk, they establish their breast milk sooner, they breastfeed longer, and they're more likely to be successful at breastfeeding. So, all of these are really great reasons to put your baby skin to skin immediately after delivery. Skin to skin contact is good for you as the baby's mom because whenever you put the baby against you, hormones are released, and this helps you bond with your baby. It gives you this real euphoric feeling. You feel very good and very relaxed. It's like a natural drug, and these hormones are also responsible for helping your uterus to contract, which will help you not bleed as much after you deliver. After you deliver your baby, you're going to be hungry, you're going to be exhausted. A lot of people have a ton of family members that come in, and no one knows more than a labor nurse that everybody loves a baby. So, even though, everybody's going to want to see the baby and hold the baby and love on the baby, let everyone know in advance that, especially that first hour or until the first breastfeed, you need to be the one to hold the baby. They'll get their time, okay? And just remember that you're never going to get this time back with this baby, so try to make the most of it. Every single day I help people breastfeed, and every single day I hear people say the same things. Do I have anything to give my baby? How do I know my baby's getting enough milk? Okay. And I always respond the same way. Look, I'm psychic. I knew what you were going to ask. And they always say, how did you know? I'm just that good. Okay? No, I'm just kidding. But everybody asks, do I have anything to give my baby? And the answer is yes. Okay? If you try to put your baby to your breast, you are more than likely going to give your baby enough food. And you're going to know that you're giving your baby enough milk because they're going to pee and poop. Okay? And just ask your nurse, what they expect the baby to pee and poop. But, at 24 hours, we're really only expecting the baby to pee and poop one time. And if you are, really trying to put that baby to your breast, the baby is more than likely going to pee a lot more than that. Anytime, I see a mom breastfeeding, sometimes the way they're laying, I don't know if, they're just like at a bad angle, or it just seems like most moms are obsessed with, can my baby breathe? It looks like their face is shoved in my breast. I don't know. And, I always tell people that it doesn't matter if you're having a boy or a girl. No baby loves your breast enough to sacrifice their life. They will move back. Okay. So I see moms kind of like shoving their breast down to make sure that their baby's nose has a clear pathway, and that just pulls the nipple out of their mouth. So, so try not to worry about that. Um, Someone should not ever give your baby a bottle if the baby ends up going to the nursery, which I recommend that the baby stay with you. And that is your right as a patient. If your baby is not sick, tell your nurse, I want my baby to stay with me all night. Okay? And nobody should give your baby a bottle. And if you've told anyone that you plan on exclusively breastfeeding, bottles shouldn't be on your crib. They shouldn't be in your room. And if you at any point say, "Oh, can my baby have a bottle?" No one should just hand you one if you went into the hospital with an intention to exclusively breastfeed. They should say, well, what made you change your mind? And, maybe you'll say something like, I don't think I have enough milk, because that's what everybody says. And then that's when, your nurse can say, no, you do have enough milk. Look, your baby's peed 3 times and it's only, 5 hours old. You're doing great. So just know that, okay? And what if my baby is sick? If your baby is sick and has to go to the NICU, that is one of the only times I think it's really good to get a pump and pump, kind of anti-pump. I'm like anti-breast pump in a hospital for non-medical reasons. So like if your baby is with you, I don't recommend the pump, but I'm going to get to that. But if your baby is sick, then yes, ask for a pump, ask for help using it, and just you have to be kind of like on a strict regimen, but of but you have to kind of not meet some guidelines, but you have to kind of have a schedule for pumping, because it doesn't make as much milk as a baby's mouth to your breast. Any medication that your physician gives you, or your midwife gives you, is not going to hurt your baby. But if you have any questions, just ask your nurse, your lactation consultant, or your provider. Okay, so why can't I just use the breast pump? So again, it doesn't matter if you have a $500 breast pump. Nothing gets milk out like a baby's mouth to your breast. And whenever you use a breast pump and you put it on, and then you get just a little bit, what does everybody say? I knew I didn't have anything to give my baby. But no, you did. Your baby only needs a quarter teaspoon a day for the first 3 days of life. But there's just something in us that we want to see. We want to know exactly how much our babies are getting, but you really don't need to know as long as they're, not losing a super excessive amount of weight. If they're peeing and pooping, and you are actively trying to put your baby to your breast, your baby is more than likely going to get enough to eat. So once you go home, you may have questions or need help. Who will you ask for help? If you click on concerns after you go home, it'll link you back to my blog, and you can print this out. And if you, write down, like physically write down and stick it on, your refrigerator. Who are you going to ask for help? Okay. You can ask me. You can. I'm going to provide some information at the end, but reach out and find somebody to ask for help. So the difference between Foremilk and Hindmilk. Your breasts actually only make one type of milk, okay? But I like describing it this way because I think it's easy to understand. So whenever a baby first starts to breastfeed, the milk is very thin and watery, okay? And that's the milk that's like really digestible and helps your baby pee and poop all the time. Okay, and as the baby keeps feeding, the milk gets thicker and thicker and thicker. Okay, and that's what they used to refer to as Hindmilk. This milk is filled with all types of fat. Okay, and this is what's going to help your baby feel full, which I hope is going to help your baby sleep longer. If anyone mentions jaundice, you want to continue to breastfeed. Make sure that everyone, including your baby's doctor, knows that you have a desire to breastfeed. If anyone even says the word jaundice or orange or ooh, glowy or whatever they may say, just breastfeed more frequently. Jaundice is an accumulation of bilirubin, which is a byproduct of red blood cells, and it's excreted through your baby's poop. Okay, so like I said before, breast milk is so digestible that, and it is so much more digestible than formula. So, if you're trying to excrete that bilirubin, you want to breastfeed more frequently. And if they're good a supplement, ask if you can supplement with expressed breast milk. So if they start to say jaundice, ask them, well, can I, start to pump just to stimulate my breast more? But just know you may not get much initially, but if you keep doing it, you'll eventually get rewarded. So if your baby is sick and it has to go to the NICU after delivery, it's even more important that you decide to breastfeed. If you know in advance that you're going to have a NICU baby, or if you find out after you deliver, you want to immediately ask for a pump, okay? Especially if it's a surprise NICU admission, you may be very like, oh my gosh, and distraught, and but just kind of stay focused and immediately ask for a pump and get that started. The sooner you start to pump after delivery, the more milk you will. It helps to establish your milk quicker. And also you can, utilize hand expression. I'm going to post a separate video specifically related to hand expression. Ask your nurses and your baby's doctor if you can still try to put your baby to your breast. So some hospitals are very different, but even if your baby is in the NICU, in most cases, you should still be able to put your baby, to your breast, or at least try to put your baby to your breast. A NICU, it's like a different world. So, they have a lot of different rules and regulations, and nobody wants to do anything that's going to hurt your baby. But just tell them, I really want to hold my baby. Is there any way? And they'll tell you yes or no. They may say, no, it's not a good idea right now because we don't want the baby overstimulated. But at least if you let them know that you really want to do it, as soon as you can do it, they'll be more likely to kind of help you out. And ask to use skin to skin contact as soon as your baby is stabilized. So as soon as they allow you to, try to put the baby skin to skin. My second child, I knew that he was going to be a NICU baby. He was born, he was preterm. And, whenever I delivered, he had a lot of trouble breathing and he had CPAP on and he had IV lines. And, I always used to tell my patients, don't be scared of that, but it's scary. I didn't want to mess anything up. I didn't want to, move anything. I didn't want to hurt him, and I had to keep telling myself, no, your baby needs you. Your baby wants to feel your touch. And so, as soon as you can, try to put your baby to you, try to hold your baby, because your baby needs that too. These are just some additional resources. This first one is one from Texas Children's. It's a downloadable free file. It's called Breastfeeding Basics, and it's fantastic. This website also has information about all kinds of information about breastfeeding, but it also has where you can email a lactation consultant, you can call a lactation consultant, and you don't have to deliver at this hospital for them to help you out. Text for Baby. This is a great site that had a lot of, like Q&A type information on there, and I thought it was really helpful. And then this breastfeeding resources by state. This is something that I created maybe about 6 months ago. And I just tried to put, different breastfeeding resources in alphabetical order by state. If for whatever reason a nurse is listening to this, or, anybody that knows of an additional breastfeeding resource, please, just shoot me a message and let me know, and I'll be glad to add it, because our patients need good, reliable sources anywhere they can. So just remember that you have rights as a patient and you have rights as a mom. I've worked for different hospitals, and sometimes, especially, I've noticed that a lot of my younger patients, they just think like they get to the hospital and they've relinquished control of everything. And just know that no one can do anything to you or to your baby, that you don't want them to, as long as you're not going to cause harm. So you have the right to say, I want to breastfeed. I only want to give my baby express breast milk. And if anyone thinks that this is going to harm your baby, a physician or a midwife or some type of provider is going to come and talk to you. A neonatologist, somebody will come and talk to you. But just know that you have, rights as a mom and rights as a patient. So just some quick tips to remember. Anytime your baby is awake, you want to try to nurse your baby, especially while you're in the hospital. Like literally, you don't have anything to do. You're watching E! News or Keeping Up with the Kardashians, and you're just sitting there kind of like relaxing. So just pop the baby on the breast. And they're more interested in feeding when they're wide awake and alert. If your baby falls asleep, you can try to rub their back gently or kind of like massage their head gently. You can sit them up and you can pat their back. If they still act sleepy, place your baby skin to skin, wait for them to wake up. Your baby, your smell is the only smell a baby can identify at birth. And so when you put them skin to skin, it's kind of like being next to a bakery. You weren't hungry, but then all of a sudden, it's like it smells good, and then you wake up. Okay, so put them skin to skin. It may take up to an hour, and then hopefully they'll wake up and want to breastfeed. And just know that the more you try to breastfeed, the more milk your body's going to make. No pump is as good as a baby's mouth, so just remember that. And ask for help. If you don't get the kind of help that you want, or that you think that you should get, ask for someone else. I think a lot of nurses, I'm so guilty of this. I never want to upset anyone. I just want to be like the good patient. But really, Who cares? You know, we are here to help you. And so if we're not doing something that you like, just ask for a different person, ask for somebody to help, or be you know, be nice about it, but just say, you know, I really needed help with breastfeeding and I don't think you're providing appropriate help. Is there anybody else, you know, that can help me? You know, thank you so much for your thank you so much for trying, you know, but don't be scared to, you know, be polite, but ask, you know, ask somebody else if you don't think you're getting the help that you need. You know, and so that's the end of the slide. I just wanted to say one more thing about, you know, keeping the baby in